So thank you for coming and for sticking with me. Again, this is being video recorded for those McIntyre Powder project miners and mine workers and their families across Canada and around the globe. And for anybody else who might be interested in this and learning about it. So I have been going around to Northern Ontario mining communities in 2023 with this information. It really became important to me when you do the work to try and figure out what happened to the McIntyre Powder project mine workers and what other things that they were exposed to in the mines. And you gather a lot of information, you put your life's blood and sweat into it. And then you get calls from somebody saying, you know, my husband died. You send out something to them and they say, oh, he died in the spring or something. And as I've been losing more and more of them, my own mortality sits in and you're like, okay, so I did all this work and you're getting all this information together, and there's a lot of great organizations like OHCOW. Some of my colleagues are back there at the here for support in the hall. The occupational health clinics for Ontario workers. I just don't want this to die with me as well. And I wanted to create something that 20 years from now, 50 years from now, if somebody, some other miner's child finds out that their father was exposed, or their brother or uncle or grandfather was exposed to this, that they have a place that they can go and get this information. So I put this together and hopefully you find it useful. So who am I? I am a miner's daughter. I am the daughter of Jim Hobbs and Elaine Hobbs from Massey, Ontario. I am the founder of the McIntyre Powder project. And I'm here to provide information, resources, and supports and public education and awareness about both McIntyre Powder, aluminum dust in mining, about other mining exposures, about the kinds of health issues that can come from those, and advocate for changing in the mining industry. And I want to be clear, I am a very proud miner's daughter. I am proud of my dad for what he did in the mines for us. He gave up his life for us. He worked hard every day to make sure that we had food on the table, and I never ever felt that we were ever deprived as a kid. We didn't get everything we wanted, and we worked hard, and but we never felt deprived because of the sacrifice that Dad made. Who I am not, I'm going to be talking about things to do about health and mining, and I'm going to be talking about compensation, but I am not a legal expert, I am not a medical expert, or I am not a compensation expert. What you're going to be hearing today is things that I've gathered along the way and that I felt were important to share so that other families who are involved can make informed decisions. So we're going to be talking briefly about McIntyre Powder, aluminum inhalation, other kinds of mining exposures, diesel exhaust, silica dust, arsenic, rock block, carbon monoxide, blasting fumes, all kinds of things, ionizing radiation if you're up in the uranium mines, radon. Health issues that may be related to mining exposures, compensation claims, and then resources, services, and supports, because most people, it's not easy to navigate the compensation system. Most people don't know where to start. How do you make a claim? Who do you contact? We're going to talk about that. McIntyre Powder aluminum inhalation treatments. McIntyre Powder is finely ground aluminum dust that mine workers and other factory workers across the globe were required to inhale by their employers on the theory that it would prevent the lung disease silicosis. It did not do that, and it caused health problems of its own, and combined with some of the other mining exposures and other workplace factory exposures that you had, led to health issues. This is a photo from, I believe it was April 1964 or 65, up at Campbell Red Lake Gold Mines in Red Lake, Bombertown, Ontario. And this was a photo sent to me by one of the mine workers who was in that photo. And it's mine workers waiting on the man deck at Campbell Red Lake Mine, and they were waiting for their McIntyre Powder aluminum inhalation treatments. And the wife of the miner who sent this to me said, that's not, she said, that's the dusty environment. That's not a hazy picture. That's what, and this is before the McIntyre powder is dispersed. So from 1943 to 1979, mine and factory workers globally were required to inhale McIntyre powder. In mining industry, it was accomplished by having these canisters of McIntyre powder. They're about the size of a little larger than a D-cell battery. You'd put them into a apparatus, puncture them, and it was attached to a compressed air system. And back there is what you would see as happen. You'd be changing your mining clothes and you'd see this dust cloud come out, and the guys would all say you couldn't see the guy next to you, and you had no choice. If you tried to cover your mouth or whatever, you'd get reprimanded. Most of it was done in the mine dries at Rio Algo and Quirk 2, where my dad was exposed. They actually had a chamber. They called it the guys called it the gas chamber, the dust chamber. That they would walk into before they going down in the cage, and they would lock the door at both ends, and they'd be in there for 10 minutes. And one guy told me if you didn't do your 10 minutes, if you got out at 9.5 minutes, the supervisor would send you back in for another 10. So I started the McIntyre Powder Project, which is basically I started doing a voluntary registry. I went out to grocery stores and the malls and union halls and just out in the community, and just started talking to mine workers who were exposed to this and said, are you sick? Do you have any health issues? Where'd you work? What were you exposed to? And I put together this website. Like I say, it's not pretty, it's not a fancy website, but it's got a lot of information on there about, if you look under resources, it'll tell you where in Canada and around the world that this was used. To give you an example, here's just the Ontario mines that used it. In Ontario, there were 4 main mining camps that used it. Up in Timmins, the gold mines in Timmins, there's about 16 there, Honor, Bonnetall, McIntyre were where it was created, but it spread to all of those gold mines up in Timmins that during this day. Kirkland Lake, Virginia town and area, there was I think 11 different mines in that area that used it. Red Lake, Bombertown, again, the gold mines up there used it. Gold mines and uranium mines tend to have higher silica content in their ore bodies. And so it wasn't used here in Sudbury at the nickel and copper mines, which has a much lower silica content in the mines. And then of course Elliott Lake, both at Denison and Rio Algo mines used this. So here's a few pictures. Bob, you can see yourself up there with Dad. The Steelworkers Hall here was the site in 2016 in October for a McIntyre Powder intake clinic, and mine workers and their families or their surviving next of kin came here and registered. The occupational health clinics for Ontario workers, you see some of them up front here, they gathered this information and they continue to work on those clients' cases every day. I now work with and for the occupational health clinics for Ontario workers, and they do an excellent job. They have occupational hygienists, ergonomists, nurses, doctors, and they can look at a worker's exposures and their job duties, and they can give an opinion. We think this is work related or not, and here's why. They'll look at the scientific literature that says what kinds of exposures and at what levels can cause what kinds of health issues, and they've really pushed this issue along. The Occupational Cancer Research Center became involved in this because people stood up, because of the McIntyre Powder Project, because of OHCOW's work, because of the steelworkers and other support that we got from various unions. They did research into, they basically, every miner in Ontario has a record called the Mining Master File record, and we'll get into that later. But it's a record up until 87 or 88 where when you had your miner's chest x-rays, they would mark down the date that you had them, they would give you a chest x-ray rating code, and they would say aluminum yes or no, you got aluminum yes or no. So the Ontario WSIB, the Workers' Safety and Insurance Board, used to be called Workers' Compensation Board, they have a copy of these records, and so you as an individual can apply for these records. We'll talk about that later. But they have records on about 90,000 Ontario mine workers. They did a study back they published it in 2020, where they matched up they were able to match up about 36,000 of the 90,000 records with Ontario health databases. They just looked at neurological disorders at that point, and they looked at the ones who got McIntyre powder, the ones who didn't get McIntyre powder, and the general population of Ontario. And they found a statistically significantly higher risk of Parkinson's in those who got McIntyre powder. They also found higher rates of Alzheimer's and motor neuron disease in mining in general, whether you were exposed to McIntyre powder or not. And the Occupational Cancer Research Center noted that we needed to do more research into that and why they are, and looking at things like traumatic injury, diesel exhaust, arsenic, radon, whole body vibration, all of which can contribute to those neurological disorders. In 2022, in January 2022, Parkinson's related to McIntyre powder exposure was added to the Schedule 3 occupational diseases. So if you were exposed to McIntyre powder and you later developed Parkinson's, it is now recognized as an Schedule 3 occupational disease. So the gentlemen that were here this morning who have Parkinson's, we will help get you a claim started. So that was McIntyre powder, and I can spend 2 hours just talking about the history of McIntyre powder. That's not what I'm here for today. I'm here to talk about full mining exposures and how to get help. So what are some of the other mining exposures that people have? Here's a list of some of the things, and I want to read them out because I think it's important. Diesel exhaust, silica dust, blasting fumes, drill oil mists, lubricants, metalworking fluids, welding fumes, asbestos, arsenic, degreasers, carbon monoxide, cement shotcrete, rock and ore dust, radon, ionizing radiation, vibration. Vibration is not good for you. Noise, shift work, heat, cold, extremes, solvents. We have somebody from CROSH here, the Center for Research on Occupational Safety and Health, which does a lot of work trying to develop tools to try and mitigate some of this stuff. Gloves to help reduce vibration and mats and stuff like that. So their work is really important, and I'm glad that they joined us here today. So IARC, the International Agency for Research on Cancer, publishes, they publish lists of known carcinogens. And here they have a group 1 list, which are known human carcinogens. And this is a small smattering of the kinds of things that can cause cancer. Smoking can cause cancer, it's a group 1 carcinogen. Alcohol can cause cancer, it's a group 1 carcinogen. So are arsenic, asbestos, crystalline silica, diesel engine exhaust, ionizing radiation, nickel compounds for the workers here in Sudbury who work in the nickel mines, radon-222 and its decay products, welding fumes. If you go back to that list, these are things that mine workers are exposed to. So if workers are being exposed to things that we know cause health issues, let's talk about what kinds of health issues they cause. The OCRC, the Occupational Cancer Research Center, is an excellent, and CareX Canada are excellent resources for the kinds of health issues that can be caused, as well as OHCOW that we'll talk about. So they do various research and they publish it on their website. So people can access it there and look at it. So this one looks at lung cancer and the types of health issues that can be caused by that. CareX Canada looking at silica. Silica dust, inhaling that can cause silicosis, scarring of the lungs. Your lungs become hard. They become they're not as elastic. It's harder for you to breathe. They can also cause other things like pulmonary tuberculosis, other kinds of lung diseases like COPD, chronic obstructive pulmonary disease. And also autoimmune diseases like rheumatoid arthritis can be caused by silica dust exposure. The USW diesel particulate steelworker United Steelworkers Diesel Particulate Project was started here in Sudbury to look at reducing the amount of diesel exhaust that we're exposed to. Diesel exhaust is a killer. It can cause a number of short-term and long-term health issues. Krosh is working with them on that, as well as OHCOW. Short-term health effects can be headache, fatigue, irritation of your eyes, nose, and throat, chest tightness, cough. Some of the long-term health effects can include lung cancer, bladder cancer, COPD, so emphysema or chronic bronchitis are forms of COPD, pulmonary fibrosis, heart and vascular disease, and then worsening of existing conditions like diabetes. So there's some information here, although it's dated because they were successful in reducing the occupational exposure limits in Ontario for diesel exhaust particulates, and they're going to keep working to lower that as well. So if workers are being exposed to all of these things and they are getting sick from them, what kind of compensation is available? The million-dollar question that I get all the time is there a class action lawsuit and is there general compensation available for McIntyre Powder exposed workers? The answer is no. There is not a class action lawsuit. Have I looked into it? 3 times with 3 different law firms, twice at the request of mine workers who were exposed to it, and once after finding some documents through a WSIB Freedom of Information request that I initiated. And the problem is that there's a lot of barriers. There's barriers to doing a lawsuit in Ontario for civil action. One of them being that the absolute time frame is supposed to be 15 years from the time that you're exposed. And very interestingly enough, when the McIntyre Research Foundation closed its doors in 1992, they donated their records to the Archives of Ontario, and they put a 15-year ban on anyone accessing those records. So there is not general compensation just from the fact that you were exposed to McIntyre powder. Do I think that you should be? Absolutely. If you had to inhale that crap once, you should be compensated for that. I'm actually surprised that somebody in the United States hasn't picked up on this and started a class action lawsuit down there, because this was used across the states as well. So you can, however, if you become sick from your occupational exposures, you can make a WSIB claim, a workers' compensation claim, and we're going to talk about how to do that. Some of the benefits of making a claim: you can get lost wages if you had to quit, if you had to stop your job because of your occupational disease or injuries. You can get compensation for lost wages. There's non-economic loss awards. If it was prior to 1990, there's pensions, but if it's after 1990, you get usually like a lump sum to say, sorry, we gave you COPD, sorry about your lung cancer, here's $5,000. And they rate it, they divide up the body like a meat chart, and it all adds up to 100%, and basically your lungs are worth 20%, this eye is worth this much, and your dominant hand is worth this much. It can never add up to more than 100%. It's hard to swallow. But one of the things that does come with that, though, is healthcare benefits, and that could be substantial. If you're dealing with late-stage COPD or Parkinson's or cancers, and you need nursing care, and you need oxygen and home care services and stuff like that, and you have an occupational disease, you can get healthcare benefits that cover your drugs, that cover those kinds of things. They can pay long-term care costs. There are McIntyre powder exposed mine workers who have Parkinson's who are in long-term care homes that are being paid for by WSIB because it was an occupational disease. So those kinds of things are substantial. And I know with my own family, that's what we really wanted the most at the end for Dad, was just to keep him at home and to be able to provide him with the supports he needed. But at that time, it wasn't recognized that he had an occupational disease. And Dad had 3 occupational diseases. He had white hand from vibrations. That was recognized while he was still in the mining industry. He had COPD and he had Parkinson's. And those weren't recognized, both of them were not recognized until after he died. He wasn't diagnosed with the COPD until autopsy. Even though he was having difficulty with his lungs, we didn't know what it was. So it's really, if somebody dies of an occupational disease, their funeral expenses can be reimbursed. There's death benefits for surviving spouses, survivor benefits, which is like a monthly pension for life. There's also independent living allowances, caregiver allowances, things like that, personal care allowances. I know because of Dad having Parkinson's and this McIntyre Powder project really focusing a lot on that, people don't realize the other kinds of health issues that are there in the mining industry or that they can get help for. These are examples of accepted WSIB claims. These are ones that have gone through and have been accepted. Silicosis, lung cancer, bladder cancer, prostate cancer, thyroid cancer, kidney cancer, pulmonary fibrosis, multiple myeloma, interstitial lung disease, COPD, Parkinson's, hand-arm vibration syndrome. My guys know it as white hand or Raynaud's, which may be different things. That's why I'm not a medical expert. Rheumatoid arthritis, noise-induced hearing loss. These are the ones that I'm aware of. There's also things that we think are related to exposures in mines, things like sarcoidosis. It's a rare granulomatous disease that affects the organs of the body, often the lungs and usually one or more other organs in the body. And we have 12 confirmed cases of a rare disease amongst our about 500 and some workers that are registered with OHCOW for the McIntyre Powder group. I don't think that's a coincidence. And when you look at the first responders at the World Trade Center and some of the deaths that they were exposed to, they have a cluster as well of sarcoidosis cases. So OHCOW is doing a lot of work, and they have a website that has mining exposures and health papers that they've done, and I brought many of them here today. And you're welcome to take those papers, and you can use them as you're filing WSIB claims. You can put those papers, if you've got lung cancer, put in that paper with it. Occupational disease claims in Ontario are handled through the WSIB head office. Right now it's in Toronto. They're apparently moving to London. But you can call that 1-800 number and you can start a claim over the phone. They will be asking you questions that are contained on, there's 3 other ways that you can apply, but they're going to be asking you questions on a Form 6. This is a Form 7. So an employer can report on your behalf that a worker has an injury or an occupational illness. There is a Form 8 that your doctor can fill out saying that you've got an occupational related illness or injury, and that those get filed with the WSIB head office in Toronto to start that claim. Or you can fill out a claim called a Form 6. I have, for the people gathered here in person, I have Form 6s here that you can take back and take a look at. They can be intimidating and overwhelming because they're meant for disease or injury. So some of them will ask you questions like, what time and date were you aware? What date and time were you aware that you had COPD or like your occupational disease or illness? Who can answer that? So don't let that be the barrier to stop you. There are people that can help you to fill out those forms, and I've been helping a lot of people do that initial paperwork. So it's a 4-pager. It talks about, your name and information. If you are an estate, you can apply on behalf of a deceased mine worker. Okay, you can make a claim on their behalf. Usually there's some legal barriers around that to show that you have the right to represent the estate, and we'll talk about that a little bit further. But basically it's a 4-page form that asks you about your doctor, doctors, you might have medical records, did you lose time from work, those kinds of things, and additional information. Those forms, you fill them out as best as possible. And I just need to be clear, it is the responsibility of the Ontario Workplace Safety and Insurance Board in Ontario, and other compensation if you live in other provinces. It's their responsibility to gather the information needed and make a decision. It's not your responsibility to do that. However, they need to know things like names, dates of birth, social insurance number, things like that, so they can gather your employment records. They can gather your employment records from the using the Service Canada employer contributions, your CPP employer contributions list. They can go to the mining master file to get some mining history records. And they can get medical records, but they need to know who your doctor is, in order to do that. So who can make a claim? So the injured or ill worker themselves can make a claim. If a worker is incapacitated and their power of attorney is active, so if they are at a point where they cannot make decisions for themselves, the power of attorney can make it on their behalf. The estate of a deceased worker can, and a surviving spouse or dependent children can claim survivor benefits in and of their own right. The kinds of information that you need for WSIB claims, or that will be needed by the WSIB to collect that, would be work history, medical records, if you were exposed to McIntyre powder exposure, confirmation of that, cause of death for claims where the occupational disease was involved in, contributed to the death. Estate authority, so usually a will, copy of the will, copy of the death certificates, social insurance number, that they use that to find your employment records. Some of these guys died before social insurance number system came in, so they may not have that, and that's okay. They can find it through other means. Dates of birth and dates of death, and sometimes it's hard to gather this information when somebody's died a long time ago. You might have been, some of these guys were, these children were kids when their dads died, and sorry, I want to back up. I'm saying males a lot, but like all of my guys are males on my volunteer registry, other than one lady who thinks that she was exposed as a contractor who serviced the mines. And that was because a lot of women were not allowed underground until I think the late 70s or early 80s. So this is an example of the Ontario Mining Master File record. You'll see it was digitized so that the information on the handwritten cards, this is my dad's actually card up there. He gave me permission to use this for my project work. And you'll see, I'm not very good with these pointers. So you'll see this, there's a column over here, aluminum, yes or no. So when he worked at INCO, he didn't have aluminum dust exposure, but once he got over to Quirk 2 in Elliott Lake, he did. So that's an important record to show aluminum dust exposure. But like I say, WSIB has these records, so they just basically need your name and date of birth and social insurance number and stuff, and they'd be able to find some of this stuff. There are the Ontario Regulation Film Services, so your actual chest x-rays from the mines still exist. And they have written records as well that have pulmonary function tests, so sometimes you need to show that what your lungs were functioning a baseline. You can go back and get those records as well. They're done through Freedom of Information requests. There's a national dose registry for radiation for people who were exposed to radiation, ionizing radiation in uranium mines. Sputum cytology, that was a voluntary program that ran for the uranium mines where you'd spit in a tube and they would look to see if there was cell changes that might indicate that you might have lung cancer or esophageal cancer or that kind of thing. Medical certificate of death, the Form 16, you can get information about causes of death, and Service Canada employment records as well. So potential sources of information for your work history, the Ontario Mining Master File, your miner certificate, so those mugshots that you saw in earlier when we were showing in a previous presentation about mine workers who had to have their chest x-rays, they would have cards and they would have little stuff marked on their cards there as well when they worked and stuff. Service Canada employment records at the WSIB can get that information. Employer records, even for decommissioned mines, there are employment records available, closed mines. Publications of employee service recognition, sometimes you would get, the Rio Atom or Denison Nucleus or different things like that where they'd have 25-year employees mentioned and stuff like that. The miner certificate in Ontario Mining Master File can also help confirm McIntyre powder exposure and often list the worker's social insurance number. And that's a close-up of what a mining master file record looks like. And you'll see that under x-rays they have rating codes system. When you got to a class 5, that was silicosis, and class 4 was pre-silicosis. This is an example of a miner's card, a miner certificate card. This is Hugh Carlson from Red Lake, who graciously allowed us to use his mining card, and he was a student up at Dickinson Mine, and you can see there it says aluminum dust, yes, in that column. The year of birth, just when you're applying, if you're applying for a mining master record, file record, the year of birth on the miner certificate is often 1 or 2 years earlier than the actual year of the birth of the mine worker, and that's because you had to be 18 to go underground and 16 to work on surface, and workers would just say that they were a year older or 2 years older than what they were to be able to do that. Medical records, potential sources of information, family physicians. I think family physicians have a retention of 10 years after they've last seen a worker or after the worker has died. So it's really important to try and, if you've been thinking about claims and somebody's died within the last 10 years, starting them now is good. Hospitals retain them for a lot longer. I think it's closer to 26, 28 years. Long-term care homes may have some records, pharmacy records about medications that they took for different ailments. I can tell you, there was one of the people that I know through the McIntyre Powder project work. His father, they had a medical alert bracelet showing that he had Parkinson's, and they had a long-term care certificate, home certificate with a photocopy listing the guy's his father's diseases with Parkinson's. There was no other medical records that existed other than his medical certificate of death, but they won their claim. And they got survivor benefits right back till when he died. It was substantial, $750,000, I think, of going back. So there's, the survivor benefits are really important. Autopsy records, medical alert system, disability records. If somebody had to apply for disability with CPP or whatever, sometimes there's forms that they have to fill out. The medical certificate of death, the Ontario Form 16, this includes causes of death and sometimes lists other serious health conditions. Like it has the immediate cause of death, other health conditions that, contributed to the cause of death but wasn't like the immediate cause, and then other health conditions that didn't contribute to the cause of death. Sometimes this is the only record that's available. So if a worker died in Ontario, you would have a record. When the coroner or medical person signs off, you would have that record. You can request this, there's a medical certificate of death, Form 16. You can request it through the Office of the Registrar General, Service Ontario. The form is called 11075E. I found it hard sometimes to find this online. I brought, for those of you gathered here today, I brought copies of them if you are needing one to apply. And this is the information for the Office of the Registrar General and where to find. If you have any questions about applying for the medical certificate of death, you can do that. And what you are looking for is a certified copy of statement of death and medical certificate of death extended long form. So when you're applying, you'll see that you can just get a regular death certificate. You can get a long form, but it's the one at the bottom there, the certified copy of statement of death and medical certificate of death extended long form. They're $22 each. I often ask people to start there. When there's no medical records available, start there, see what that says, because that might be your only proof. And if to go through the claim process and if no medical records exist, it's pretty hard to do anything. Establishing a state authority. Who has the right to represent the worker's estate for the WSIB claim? I don't fully know that answer, but I do know that if you are the executor of the estate, you have that right. So sometimes, let's say a worker dies and the wife is the executor of their estate. When the wife dies and one of the children is the executor of that estate, in the past, that child has been able to represent for both estates because it's like a continuation. So you had this estate, but I think you need to establish that with the WSIB, what they need for proof or whatever. State documents, wills, death certificates, funeral homes. You can often go back to them to get the death certificate. Sometimes they have the funeral home records will have social insurance numbers on them, dates of birth, dates of death, next of kin. It can be important to get that. The Office of the Registrar General, for wills, sometimes lawyer's office, family members, public or court records. This was an interesting one. This came from a family that actually went to when the father had died and the estate had to be transferred over to his wife. There was land transfer records that had a copy of the will and there. So that was how they found that. So what happens after you start a WSIB claim? A WSIB claims adjudicator is going to be assigned to your claim. They're going to look into what you were exposed to, what were your work duties, what were your work exposures, what does the science say about those exposures and their relationship to your health issues. They sometimes will refer internally to one of their medical consultants or their occupational hygienist to give it their opinion. They look at WSIB policies, some of which are very outdated and need to be updated based on current science. And then the WSIB claims adjudicator makes a decision. They send you a decision letter. This process can take months because it takes a while to gather some of that information to do that. If they deny the claim, you can appeal the decision. And I just want to talk about some of the resources and supports that are available to help you with that. First of all, medical assessment and diagnosis. Respiratory conditions for mine workers, they're my biggest. It's my largest binder that I have at home of the McIntyre Powder Project miners. Respiratory conditions. And some of those are symptoms with no diagnosis, many of them. I don't know if you've ever tried to get your husband to go to the doctor sometimes. And some of these mine workers are very tough, and they don't go to the doctor always. They just kind of put up with things. But it's really important if you're having shortness of breath, they're coughing, things like that. Talk to your doctor about getting assessed. You had all these chest x-rays in the mine, then they kind of stopped doing them. What's your breathing like now? There's a test called a pulmonary function test or spirometry where you have to blow into a tube and they are measuring your lung capacity. That test is used to diagnose things like COPD, asthma, respiratory conditions, restrictive or obstructive respiratory conditions. Getting that diagnosis is important. If you made a claim and said, look, I'm short of breath, and you make a claim to the WSIB, they're going to want to know what you're diagnosed with. They may send you for testing. They've got St. Michael's Hospital in Toronto. They may send you to places to get assessed. But talking to your doctor about it. And I just have to say, I can't imagine what it's like to go through medical school and the vast amount of information that you have. But I know that one of our OHCOW doctors taught at one of the universities, and he said they had, in all of their medical training, they had 1 3-hour session on occupational disease, 1 3-hour lecture. So if you miss that lecture, and I think it's really important to that medical communities and your primary medical practitioner asks about these questions. When you go in and get your family, get your annual checkup, they might ask, what do you do for a living? But for the most part, it's how much wine do you drink? How much exercise do you get? What's your weight? What's your blood pressure? Diet and exercise, lifestyle types of things, and they can absolutely contribute. What's your family history? Family history of medical, that's important. But what you're exposed to for 8 to 10 to 12 hours a day, every day of your working life is massive, massive. And we need to be asking those questions. And it does my heart good. When I first started this, I'm part of the Ontario, it's a Ontario health study. So I signed up as a volunteer participant for that. So they ask you different questions stuff. They never asked me one question about where I worked. A couple of years ago, we got a questionnaire. We're interested in knowing, where people worked and what kinds of health issues you have. I think that this kind of work is making a difference to the powers that be, and they're starting to look at what people are exposed to and what kinds of health issues that they ended up with. Your union, if you are an active union member, you can talk to your union representatives, your health and safety representatives. They have, most unions have a workers' compensation representative who will represent their members for workers' compensation claims. Generally, once you've retired, unless you're continuing to pay union dues or whatever, that part ends, and so you would go to the Office of the Worker Advisor. It's a free service through the Ministry of Labor's Prevention Branch. They can help you with appeals. They can help you, with compensation claims, give you opinions, represent you for free. The occupational health clinics for Ontario workers, if you have a claim that's denied, or even if you just want to know if your health condition is related, you can register with them. This was from the McIntyre Powder Intake Clinic in 2016. Yours truly is over there talking to my dad and mom, who were talking to one of the occupational hygienists at the time, and workers came in and estates, and were able to talk about what health issues they have, and that information gets investigated. OHCOW is a nonprofit agency. It's labor directed. It helps to give second opinions about this and does a lot of prevention work. They're a really good organization, but it can take a long time to investigate these occupational disease clusters. That was 2016, and there's some people that were still trying to review their individual records. It takes a long time to gather information, but it helps to get some of the answers, whatever answers may be available. And OHCOW on their website has published papers around different kinds of health issues. I just saw that trading one risk for another. For anybody who wants to know anything about the McIntyre Powder history, I co-wrote an article. I was lead author on an article that got published in New Solutions, a journal of environmental and occupational health policy. And there's copies up here, and I did a follow-up article with my co-author T. Gadati, who's an expert in occupational disease. He's amazing. That summarized all of the kinds of things that I was hearing from mine workers for the McIntyre Powder project. So it's called Breathe Deep, Boys. So if you want to know any of the history, please pick those up, and you can take more than for yourself to be able to give to other people. And for those watching this online, it's available through New Solutions Journal. You can look up Trading One Risk for Another or Breathe Deep, Boys. The McIntyre Powder project is a resource. You can go on there for links on some of the media reports that was done on this, links to other important information about aluminum and health issues. You can look at resources, which is basically lists all of the licensees, the industrial licensees that were licensed to use McIntyre Powder. Phone number is up there, and my email is up there. People can contact me if they have questions, and I'll do my best to get back to you. Have some mercy on me, because after I do some of these presentations, I get a lot of calls, so it might take me a little while to get back to you, but I will. And if you haven't heard back, please call me back. You are important to me, and I'll do my best to help you. That's it. That's my dad and I in 2008, I believe. 2008 or 2009 for Father's Day. I purchased him a brick with his name on it at the Elliott Lake Miners Monument. It's a beautiful place to go to if you've never gone. They have bricks if you worked in a mine in Elliott Lake, you could, for $150, get your name inscribed in a brick, and it goes around whether you are healthy as a horse or whether you're sick or not. But they also have a miner's memorial wall, and on that wall, if you died of either a workplace injury, a workplace fatality, or of occupational disease, you can get your name up there. Thank you. We have a question? Yeah.
I know it's early days yet, but is there anyone that can determine if Alzheimer's or Parkinson's is genetic, and might it become passed on to grandchildren of this group?
So one of I think it's called epigenetics. Somebody can correct me if I'm wrong, where somebody's exposed to something. Andrew's nodding his head. Thank you, Andrew. Epigenetics is where you're exposed to something, it changes your cells, your DNA because of that, and then you can have a child that has different health issues or whatever, potential risk of different health issues because of that. So we have not studied that with this. I know that there have been studies done before for things like lead and that kind of thing. We haven't studied that. So you're talking about secondary exposure. So if somebody, and I've had that question too. So I washed my husband's clothes when he came home from work. I was exposed to that. You can't apply for workers' compensation, no, because you are not the worker directly exposed to it. But then again, so back when the workers' compensation system was formed, I think it was 1914, if correct me, my labor brothers, if I'm wrong, labor brothers and sisters. So there was a historical trade-off. You couldn't sue your employer anymore for getting sick on the job because of job, but you would allegedly have guaranteed compensation if you got sick from that job. So you can't sue them. Your only respite or recourse is to make a compensation claim. However, so if you're one of the secondary ones, if you got it, there's nothing stopping you from suing, right? Because you weren't the worker. So you're not eligible for compensation, not the worker, but there's nothing stopping you from suing. I think it'd be a tough go. You would need the research to do that. And we, like, honestly, I just don't know those answers. We just don't know those answers.
But it is transferable. I mean, the disease is still transferable.
There's absolutely a genetic component. So I know my dad's neurologist that we first met, who was phenomenal, to treat him. He basically said, you know, there's multiple toxic exposures out there. You know, it could be head injury, it could be other things. So you have a genetic, what they think is it's a combination of a genetic vulnerability to something like Parkinson's or Alzheimer's, and then you have these insults to your, you know, these either toxic exposures that can cause that. But I'm going way out of I'm not a medical expert at all, but that's my understanding, is that there was a genetic component, and like a genetic vulnerability, and then this insult. But yeah, so even if you were genetically vulnerable to Parkinson's or Alzheimer's or something, if you were exposed to something that caused that in the workplace, it doesn't have to be the only, for compensation claims, whatever it was that you were exposed to, it does not have to be the only thing. So you could have smoked cigarettes and had COPD, or smoked cigarettes and had lung cancer. That doesn't stop you from making a successful compensation claim, because you were also exposed to things that can cause lung cancer or COPD, like dust and silica dust and diesel exhaust and stuff like that. Any other questions?
Question and comment.
Okay.
Yes, the question is, has there been many studies with synergy effects with, say, silica, diesel, or some McIntyre powder and silica? I know often they look at just the ones that are combining them. It's like,
Yeah.
oh, you're mixing it, so it gets worse, right? So your it should be lowered based on the synergy effects.
Yeah, so the question for those of you, I should have brought the mic over, sorry. So basically, is there synergy where you get combined exposures and cumulative exposures as well? And do they look at that? In my experience with the WSIB, and we've been helping with a lot of people, is they tend to look at, it's very compartmentalized. So you were exposed to this much radiation, and that was under the level that we think could cause lung cancer. And you were exposed to this much diesel exhaust, but that's under the level that causes lung cancer. And then in their policies, which are outdated, and I'm saying that we've looked at them, they're outdated from the science, you know. And then you're exposed to this, but when you combine all of them together, yeah, it's not just a 1 + 1 + 1 = 3. Like, it's, you know, it can be interactive, multiplicative, additive, those kinds of things. And I compare it to, you know, if you have 10 bottles of headache medication in front of you, and you take one that's under each of the recommended doses, you're going to overdose. You can't say that this Tylenol and that ibuprofen and that is, you know, and you have, you know, the Rexall brand and the Shoppers Drug Mart brand and stuff like that. If you take one pill out of all of them while you're under the recommended dosage, but you've taken 20 or 30 pills, you're going to overdose. You're going to have problems. So That's the issue that I have with that, and we are pushing to get them to look at more cumulative exposures and combined and synergistic. The lung cancer paper and the COPD paper that were done, because lung cancer and COPD are huge in mining, they're like 50, 60, 70 pages long. They looked at all of what the literature says, of what the scientific literature says, and you can get lung cancer and COPD at much lower exposures than what workers are being exposed to. So.
Yes, lastly, I just want to thank you, Janice. For those who know, I was working with Janice. She was helping us with the diesel project, and she inspired us to do that diesel project. And we had Dr. Norman and a great team help us along with that. I consider you a hero. I think of you often as like a modern day Aaron Brockovich, but better. She's awesome, and yeah. The other thing somebody said, what can we do now? So for you, it's kind of a reactive piece because it's happened, but we still have things going on today. And I'm a worker rep at a mine, and there's some tools we have in the Green Book and other things where you can look to prevent. If we can prevent it, then it's not just recording it and getting compensation. You're going to stop it in its tracks, right? So I tell workers there's Section 183 in the mine regulation where workers have the right to ask for testing. If you see that air blue, you see the dust, or you figure you don't have enough airflow, you can ask to have that tested anytime. There's no limit. People don't take advantage of that enough. We have the right to do area monitoring testing. So outside of personal testing, if workers don't want to participate, we can ask for an area to be monitored and hone in on exposures, right? So if you think that something's going on, you don't have to wait for tests to validate the exposure. You can shut areas down or make them do the right things, right? So I always tell people, I don't think we're that great at doing that over the years, at asking for the testing or asking for area monitoring, but that's what we can do now. And if you do get exposed, ask for an exposure form. You can put those forms in, and it's a record that you were exposed. Say somebody turned on a fan and the dust kicked up, or somebody didn't change their air filters and they were blowing blue clouds of unburned diesel exhaust, or diesel fuel. You can put that on exposure and it's records, so down the road if you get something, you have something to go off, right? Because some people don't participate in monitoring, and when they do have the disease, it's tough because you don't have a lot of records. So put those records in, go see your committees, your worker reps and people at the plants or wherever you work for help, unions, Janices, reach out to them, because there is things we can do now for other things like silica and diesel and the other things before they become too,
Thanks, Jerry. It's Jerry Tebow with the Steelworkers. He's awesome. I just want to add to what you said, because you said, we're doing reactive things, which is true. You're going back to, like, McIntyre Powder has not been used since 79, maybe a little later in some of the mines. But it's important to go back and recognize that and to push for that, for compensation claims, because until it costs them money, things aren't going to change. And almost every one of the guys that I talk to, they say, my fate is sealed. I can't help what's happened to me, but I want you to make the workplaces safe for my grandchildren. And this is doing that. This is, pushing for changes to what people are exposed to, pushing to get fresh air down into mines and to reduce dust and stuff like that. Those things are all important. So I appreciate everyone that's doing that.
You're right. So when we were going out canvassing, we went to the malls and stuff with Janice, plus the mine workers with diesel exhaust. A lot of thought it was the damage, like you said, is done, and didn't realize they could still do something about filing a claim. And for some people, still today in the older ages, you think it was blood money or it was part of doing business, but it's not true. You deserve to make good money and live, right? And what's the point of making good money if you're not going to be around to enjoy it? So it's getting that mentality of respecting yourself, valuing yourself more. And then, and I encourage all families to push people too, because like Janice said, a lot of us are too proud to go to the doctors or go do whatever it is. So give them a kick in the butt if they're not listening.
Just got one thing to say is, I know you say go put a claim in and stuff like that, but I'm retired now, but I've been in a lot of cases where you don't want to do the work. We'll get somebody in there to do it for you. And I mean, by the time you come back to that job, it's already done. So that there should be looked at right now. And you trouble is nobody's got permission to get in and do this. You know what I mean? Here we are. They got somebody else to go in there. Yeah, I'm going to go in there. I'm going to go in there and I'm going to make a good dollar at it. I'll go do that job. They got to stop these people from doing that.
Let me tell you a story, because I talked to somebody who worked out west, and he said the mine manager, and I'm not dissing all mine managers or some, I have people from every level of mining on my voluntary registry. As high up as you can go, some of those guys, they were exposed when they were mine workers. So I am not dissing them, but this particular mine manager, he said, would look and see which guys had the big trucks and stuff like that. And they knew that they could get them to go do certain jobs because they had a truck to pay for. And at one of the mines in Elliott Lake, there was they called it the hot muck. It was an area of the mine that had super high radiation in it. And they would make the Newfoundlanders, they would offer the Newfoundlanders, you can have as much overtime as you want, because they knew that they wanted to go back to their families and spend extra time at Christmas time. You can have as much overtime as you want, but you have to work in the hot muck. And they put them in there. It was wrong. We're just going to wind up quickly with somebody saying something. Because the Steelworkers Hall, they actually squeezed us in here today. They have a big event happening, and we do need to get out. And I know we've run a little bit over time, but I need to get out by noon. So, Bob.
Thanks, thanks, Janice. You were talking about the hot muck at Denison. I'm very familiar with it. I used to be a supervisor in a hot muck area. And they used to rotate the crews because of the high radiation. They would rotate the crews, but not the supervisor, you know. And that goes way back. So I went through a lot of horror stories in my life, and thanks God, but the industry is much better today than what it was, you know. Thank you.
Thank you very much for everybody's patience. I really appreciate you waiting so that we can tape this for the people who can't be here, because it was really meaningful to them to be here. So thank you.